Well, today, the CDC's advisory committee will meet to talk about third doses of Pfizer and Moderna's vaccine. The booster shots, which go to really actually got the go-ahead, in fact, and are going to go to folks with immune-compromised systems. We will see those start rolling out fairly soon.
Yeah, some countries are already doing this, like Israel, Germany, and France also plan to do so next month. So joining us now to talk about booster shots is Dr. Shereef Elnahal, President and CEO of University Hospital in Newark. So Dr. Elnahal, thanks and welcome back.
Good morning.
Thanks so much for having me.
So Dr. Elnahal, let's begin and get a better understanding of who these shots would be for, right? When we say immunocompromised, what kind of medical condition specifically are we talking about? And why would a third shot be beneficial to them and not anybody else?
Yeah, it's a good question, and thanks for having me on. So first of all, the example they give in the guidance from the CDC that came out late last night was around transplant recipients. People who receive organs are often and almost always on medications that suppress their immune system, and those medications need to continue for quite some time so that your own immune system doesn't reject the organ that was just transplanted. And so there are a number of other conditions where you take medications like that, where your immune system is very compromised, and it's one of the criteria that Israel actually used when they approved boosters, although Israel also did seniors as well. So we'll see how this evolves. I do think there will be some rapid decisions over the next several weeks to months on who can get a booster and when.
Well, let's talk about the Johnson & Johnson, right? What about folks who got that shot? Why are we talking about third doses of Pfizer and Moderna, but not second doses for them?
Yeah, that's another good question. So I think the Johnson & Johnson vaccine is just a little bit later in the game with the clinical trials, with the eventual approval. And so folks have been on Johnson & Johnson by definition, on average, less than the other vaccines. And so the data has not yet matured on whether a booster is actually needed. In fact, there was a study out of South Africa that showed that the Johnson & Johnson vaccine is quite effective against the Delta variant at preventing hospitalization and death. And that was after several months since the vaccine was being used. So more to come on Johnson & Johnson. I do think ultimately that will be included in the booster plan, but that all depends on the evidence.
Yeah, and I know for some folks at home, it gets confusing, right? And that's why we have you on to kind of explain these things, and we appreciate it. And I know we've asked you this before, but to some people, this is all white noise. They're just like, well, I want to get a third shot. So what about healthy people? You're saying evolution, right, and in time possibly, but what if they want to get it now?
I don't blame folks for wanting to do that. I think there has been data published and reporting on how the Pfizer vaccine in particular seems to wane over time after 6 to 8 months. But we don't have definitive conclusions yet on whether it's needed for everybody at this point. I think the FDA and the CDC are considering that, but until we have approval on that, you'd technically be taking it off label. And there are ways, of course, for folks to know if you've gotten a third shot before it was approved. So I'd be wary of that, but of course, don't blame folks for trying to be proactive.
Absolutely. You know, early next month, though, the FDA is also expected to grant full approval of Pfizer's vaccine. Explain to our viewers why that is significant and what would allow physicians to do.
Yeah, full approval for these vaccines cannot come soon enough. It's still one of the main reasons for vaccine hesitancy that we're seeing in our community. We just recently mandated our vaccine, and when we've had these forums with our employees, that was a main thing that came up, including in the community, including with our mobile vaccination efforts. And so I think the safety and efficacy data is there, it's established. At this point, the FDA is doing a number of other things they need to do before final approval per their own rules and the law. But again, it can't come soon enough, and I hope it does.
Yeah, I mean, that's a good point to make about hesitancy. And once it has that full approval, maybe people will feel more confident. But I do want to get to this quick point, because earlier this month, the World Health Organization called for a pause on booster shots, at least for the next 2 months, arguing that more people around the world need to get their first shot, right? And put the emphasis and energy on that. What are your thoughts?
I understand the sentiment behind that. There's so much of the world that has not gotten even at least one dose at this point. Countries holistically that really have very low penetration of the vaccine. And as long as you have that, there's always the risk that a worse variant would arise. Dr. Fauci's been talking about that recently. The Delta variant arose in India when they were very under-vaccinated. However, I do think that if the data shows that effectiveness wanes significantly after 6 to 8 months, it will almost be the case that you're backtracking on immunity for folks who think they have it, which can be another bad outcome. So I get that that's a tension here, but I do think we need boosters in the United States ultimately, and that will come with the evidence.
We're almost out of time here. I just want to sneak in a quick question about kids. A lot of people are saying, okay, we're talking to all of this. What about those under 12? When are we seeing that roll out, especially as we head into schools?
Yeah, it's a good question because we have not seen this many kids come into our emergency room with COVID-19 since the beginning of the pandemic. We have folks admitted to the hospital who are under 17 at this point, again, at levels we haven't seen. So I understand that that's a major thing, especially as school starts. I really hope that assessment is done quickly. I think we do have evidence that has matured by this point or very soon. And again, the FDA has the ball on that. They authorize it. But as long as school is starting, that can't come soon enough because all 3 of my kids are under 12 and they're going to be entering school as well. So I do hope that comes soon.
Mine as well. I'm with you there, Dr. Elnahal. Thank you so much. Hopefully we can find out some information on that for children under 12 very soon. We appreciate your time and insight.
Thank you.